To see everybody. I want to thank everyone for joining us here this morning. And I believe Director Lombardi is going to kick us off, and then we'll get started. Director, I'll turn things over to you.
Thank you, Mayor. Thank you and good morning. It is my pleasure today to be here with Mayor Ginther as he introduces his proposed 2021 General Fund operating budget. I want to thank the Mayor for his leadership and support through this process, and my staff for their hard work and effort crafting the Mayor's budget, especially Aileen Heiser for her leadership. The operating budget supports the daily operations of all city departments, except for the enterprise departments, such as public utilities. 2020 has been a very challenging year for the City of Columbus. COVID-19 has created a health crisis, a human service crisis, and an economic crisis. The city auditor this past June reduced 2020 resources by negative 4.6%, or $41.5 million. This deficit was offset without using the Basic City Services Fund or Rainy Day Fund. Instead, this was accomplished by departments freezing hires, travel, and other expenditures. The city auditor has since improved the estimated growth for the remainder of 2020 to be a negative 1.5%. In October, the auditor provided the administration with the official estimate for 2021. The estimated growth for income tax is a positive 0.5%. And total resources are estimated to grow only by 1.24% over the 2020 revised estimate. Though there are declining revenues, the Mayor's proposed general fund budget is balanced in accordance with city charter and fiscally responsible. Based on the resources available, the 2021 general fund budget equals $964 million, nearly $5 million less than 2020. This budget was built upon the following: $883 million in estimated revenue, $4 million in transfers to the general fund, $5 million in potential cancellations, and $72 million in carryover year-end funds, which includes $48 million in savings from the third quarter and $24 million in additional revenue. Thank you again for being here today. And now I would like to turn the program over to Mayor Ginther to provide the details of his 2021 general fund operating budget. Mayor?
Thank you, Director, and to Director Lombardi and all of the members of his team. We really appreciate all of your work leading up to this point, and all of the other city directors that have worked so hard with Director Lombardi and his team to bring us to where we are today. I want to thank you all for joining us today. I'm pleased to present my 2021 budget for $964 million for City Council consideration. The public health, economic, and human impact of COVID-19 has been devastating. Despite receiving significant relief through the CARES Act, Columbus residents, employers, social service agencies, and institutions have suffered significant financial losses. The City of Columbus was forced to reduce the 2020 general fund budget by $41.5 million to account for lost revenue, and the 2021 budget is less than the operating budget submitted just 1 year ago. Despite declining revenue, and through the hard work of the Department of Finance and Management and all of our city departments, I'm able to submit a balanced 2021 budget without depleting the Basic City Services Fund or the Budget Stabilization Fund, also known as our Rainy Day Fund, and without contemplating a single layoff or furlough. The city's financial position, while challenged, remains strong, and reserves have been maintained to assure the city can continue to weather a pandemic that shows no signs of waning. The 2021 budget reflects a commitment to closing existing gaps, advancing equity, and making positive gains on our community's highest priorities, including police reform, affordable housing, and neighborhoods. In a year that has seen increased gun violence, homicides, and a national reckoning over racial injustice and police brutality, it is imperative that the city changes its approach to funding public safety. While funding the Division of Police remains a significant portion of the city's budget, the 2021 proposed budget reflects increased investments in public health, technology, and neighborhoods to reduce the burden on police and to formulate a more holistic approach to public safety. Our goals are to deliver the right response at the right time, improve access to a broad range of social services for residents, and focus police resources where they're needed the most. The budget for the Columbus Division of Police includes funding for continued implementation of the recommendations for reform made by the Community Safety Advisory Commission and Matrix Consulting, and fully funding the comprehensive neighborhood safety strategy, including our continued efforts to reduce the spike in violent crime. The budget also includes funding to establish and staff the Civilian Police Review Board and Office of Inspector General for the Division of Police, which was overwhelmingly approved by voters through the passage of Issue 2 last week. As part of our response to safety, we've also included funding for technology to provide a new computer-aided dispatch, records management system, and officer wellness program. In addition, $825,000 will support the expansion of ShotSpotter technology, a proven gunfire detection system to the Near East Side, another crucial tool in our fight against violence. New investments in public health will also support law enforcement, including an expansion of the Mobile Crisis Response Program to address addiction, mental illness, and people in crisis. In addition, social workers will be embedded with police and fire to better address behavioral health and advance public health strategies to address poverty and trauma, allowing officers to focus on violent crime. Let me be clear. We are not investing less in police or neighborhood safety, but instead making different investments. We are investing in behavioral health and community, not taking away money from core police work or existing reform work. We are shifting to a public health approach to poverty and trauma, not turning away from our city's crime challenges. We are focusing police officers' time on violent crime, not deprioritizing crime fighting. We're investing in community policing and diversion programs, not cutting the number of police officers. We are responding to calls in a more effective way, not asking the police to do more and solve all of our problems on their own. 2021 will be an incredible year of action for our affordable housing efforts. The Department of Development has budgeted for a new director-level position to focus exclusively on the city's affordable housing strategy, coordinate efforts across departments, and to implement action items identified in the Mid-Ohio Regional Planning Commission Affordable Housing Strategy. We've identified a recruiter to lead a national search and are finalizing the contract for the recruiter. I expect that the Assistant Director for Housing Strategy to be on board during the first quarter of 2021. The Housing Division will encourage development of housing Columbus residents can afford and leverage the city's capital investments to increase the number of affordable housing units. This budget also funds the rewriting of our zoning code for the first time in well over 50 years to make sure that our zoning code is guiding our vision and goals around having housing that's affordable to everyone in all of our neighborhoods. I also want to remind everyone that we announced $14 million, the largest ever investment from the city in a capital budget, toward affordable housing projects just last week. We will leverage those funds with private dollars, $100 million in the Housing Action Fund, to make a significant impact on this crucial issue. The Department of Neighborhoods will lead our efforts to invest in the communities that make Columbus so special and to implement strategies developed by Columbus residents and outlined in the One Linden and Envision Hilltop plans that focus on education, health, housing, safety, and small business development. The city will also continue to invest in our youngest residents, maintaining our commitment to Celebrate One and Early Start Columbus, and programming through recreation and parks will continue as well. I want to take a moment to talk a little bit about Columbus Public Health and Dr. Mashika Roberts' incredible leadership as we have faced unprecedented challenges in this global pandemic. From the beginning, Dr. Roberts has given excellent guidance to me and to our neighbors and the state on how to handle our response to COVID-19. She has 537 employees working on COVID-19, from answering the hotline to giving tests to contact tracing. Columbus Public Health has spent more than 242,000 hours fighting this infection since it arrived in March. Thanks to Federal CARES Act dollars, we were able to invest in Columbus Public Health $9 million to cover these costs. And for 2021, we've increased by general fund budget for Columbus Public Health by 23% to lead the COVID-19 response, in addition to all of the other responsibilities they have at keeping our city safe and healthy. Residents can expect continued sustainability efforts to assure a healthy environment as our city grows with the implementation of community choice aggregation, passed overwhelmingly by the voters through Issue 1 last week. This community aggregation effort is the largest in the country outside of California, and an incredible opportunity for us to move forward with our goals of being totally renewable based by 2022, 100% renewable by 2022, and carbon neutral by 2050. Community aggregation is an important, critical step to helping us realize our goals. In addition, we've earmarked $2.5 million in the implementation of the Urban Tree Canopy Initiative that will contribute not only to the city's appearance, but long-term climate reduction goals as well. Climate change is a social justice issue. That's why our work to battle it is embedded in our equity agenda. Diversity and inclusion remains an integral part of every decision we make as a city. The Office of Diversity and Inclusion will aggressively implement recommendations contained in the 2019 disparity study, including a new minority and women-owned business enterprise program. We will also advance the ODI 30 by 30 challenge to better understand how race and other factors contribute to workforce disparities, eliminate workplace discrimination, and improve workplace culture. Balancing our operating budget for 2021 meant making tough choices. So we're not planning on additional deposits into the rainy day fund or basic city services fund. However, both of those funds remain robust and intact, a testament to sound investing and financial discipline. The next steps are for City Council to take up this proposed budget, hold hearings, and vote on it in early 2021. Again, I'd like to thank our finance office and all the city departments for their diligent work to assure we would be able to maintain core city services and focus on the needs of the community during an unprecedented and tumultuous year. I'd be happy to take your questions at this point. We're going to use the raise hand function. You should see a hand icon in the bottom right corner of your screen. Click on the hand and you will see a hand next to your name in the attendee list. That's how we know you've raised your hand. We'll unmute you to ask your question. Please tell us your name and what media outlet you're with. After your question's been addressed, please click the hand next to your name to turn off the function. And if you have additional questions or a follow-up, please click it again. So with that, we'll be happy to take your questions. Please just tell us your name and media outlet. I think our first question is from Tom Bosco. Tom, good morning.
Hey, Mayor. Tom Bosco at ABC6 here. Tell me a little bit more about the social workers working with police officers. How much is that going to cost? How many do you see? And just kind of describe how that is going to work, or how you envision that working.
Well, I think, some would argue that we've asked our police officers to solve all of our community's challenges and deal with all of the issues. I think of a family in crisis who has a teenager that has significant mental health challenges and issues, and she has attempted to take her own life. Our thought is that probably the best response to that situation, that family in crisis, may not be solely a law enforcement officer, but folks who are professionally trained in addiction and mental health expertise that can help de-escalate the situation and work with law enforcement if necessary, if the person is a threat to themselves or to others, an imminent threat to themselves or others. We believe that kind of approach makes the most sense. We'll get the right response at the right time for that family in need. And make sure that our officers can focus on our greatest need, and that is helping us to reduce and battle the rise in violent crime in our community. I'll let Director Lombardi speak to the specifics. I believe that it is at least a few dozen social workers and public health professionals that would be hired at health that would be embedded with the Division of Police, and he probably has a specific dollar amount as well. Director Lombardi?
Thank you, Mayor. Yeah, Tom, That is correct. There will be a few positions, social workers and health professionals that we would like to embed within public safety. Right now, we've earmarked nearly $1.8 million for that effort.
And Tom, just to follow up on that, it would also be a dramatic expansion of our REACT efforts that we've piloted with the Division of Fire and Police as well to help address folks that are in crisis with respect to addiction and overdose. As you know, we've seen a dramatic increase in overdoses here during 2020. And again, trying to embed expertise into what our first responders are dealing with, whether they are police officers or firefighters. Next question is from Lacey Crisp.
Good morning, Mayor. You mentioned that police reform is the top of your budget. Do we know yet how much the Civilian Review Board, the Inspector General, is going to cost? Is that coming from CPD's budget? If so, has CPD been given more money to count for the additional expenses?
Thanks for the question, Lacey. We've earmarked $1 million in the City Services Fund. That should cover us for the first year for the Civilian Review Board and the role of the Inspector General. As you know, the Civilian Review Board work group has met on Tuesday to discuss recommendations. I think they have a final meeting coming up in the next week or so. We'll know more specifics about the costs and once we finalize details on the board and obviously negotiated with the FOP. This funding for the Civilian Review Board and the Inspector General position is in addition to the police budget that we proposed. Our next question is from, is it Brad Johansson?
It is, Mayor. Thank you.
Good morning.
Brad Johansson with NBC4. You mentioned a $41.5 million slash due to COVID related on this budget. I wonder if you have a response or a little bit more insight into your conversations with the governor before his address last night or after his address last night, including rulings of no dancing. Is there something else coming forward that you see that you will have to do in Columbus related to this?
Well, Brad, thanks for the question. The governor and I have been in very close communication for the better part of this year. I think he has shown tremendous leadership and a balanced approach, being guided by science and medical experts. And I support his work. I think his message last night was both very clear and laid out the dire warnings that we're facing with the exponential growth in cases, but also gave some inspiring hope, reminding us that we have faced surges before and we have flattened the curve when we worked together, both in March and July. And that the power to deal with this, to protect ourselves, our neighbors, to make sure our first responders, our healthcare workers are not overwhelmed and systems overwhelmed, putting people at risk. That power is in our hands. And we have a chance to do what we've done before and answer that higher call to protect the community. I know that the governor has made tough decisions before when he has not had other choices or resources at hand. And we will continue talking with him and looking at the numbers, listening to our medical experts. I'll be listening to Dr. Roberts and the CMOs of our health systems. And I know he will be working with his colleagues at the state level. We have a call just in about a half an hour to talk about this. And we're going to stay in close contact and do what's necessary to protect the health of people in this community and communities across the state. I think our next question is from Claire Roth.
Hello, Claire Roth, WOSU News 89.7 NPR News. You mentioned that the police will be responding to calls in a more effective way instead of working alone. You also say that money's not being taken away from their core work, but they're not being given, quote unquote, more and more work. What is being taken off of their plate if they're going to be focusing more on violent crime and going to be taken off some cases? What will that look like?
Well, I think the example I shared a little bit earlier, Claire, would be a good example of that. You know, families in crisis with mental health challenges, folks that maybe are battling addiction that have overdosed, continue to invest in proven strategies that have worked and served this community well, whether it's REACT with the Division of Fire, embedding mental health and substance abuse counselors with the Division of Police. I mean, these are folks professionally trained in de-escalation and in doing everything they can to help people get the services that they need. The last place somebody in mental health crisis or that has overdosed is jail. We need them in treatment. We need them to have the support services they need to hopefully get on the road to recovery. As I said earlier, I think in many respects, we've continued to ask the Division of Police to do more and more and more. And what we need them to focus on and provide resources to is reducing violent crime and making our neighborhoods safer. And so we need to bring more resources and support to bear for them. That's why we're investing in them and, an early detection system, these wellness programs, to make sure that our officers are able to bring their very best to protect and serve everybody in this community. We know the overwhelming majority of our officers are outstanding public servants, and they deserve the support and the resources from mental health professionals, addiction specialists that can continue to work and meet those needs. It's all about having the right response at the right time for residents, and that's what this budget outlines, Claire.
A quick follow-up on a slightly different note. You mentioned some places where the city will have to cut back. Can you speak more to how the economic dip and resulting lower revenue for the city impacted this budget outline?
Well, certainly, we have shown historically a commitment to investing in the Basic City Services Fund and the Rainy Day Fund. We believe strongly, and it was one of the commitments that we made back in 2009. It wasn't just to raise revenue for basic city services, but to reform city government and make an unprecedented investment in our Rainy Day Fund to prepare for the crisis and potentially a longer term recession we may be facing because of this global pandemic. We would have liked to invest more into the Basic City Services Fund and the Rainy Day Fund. Clearly, we're going to have additional significant needs for public health and our response. And that's why we're urging Congress and the current president and the president-elect to come together to work in a bipartisan way to get more COVID stimulus dollars to states and cities across the country. COVID-19 is not going away. And quite honestly, I know a lot of economists are concerned that the longer this crisis lasts and the challenge with getting this virus under control could lead to a longer term economic recession. And we need to be planning on that and preparing for that. And so there are a number of things that, we would have liked to invest in, but because of the crisis that we're in and the resources available to us, we had to make some difficult choices. I think our next question is another question from Tom Bosco.
Actually, I didn't realize my hand was still up there. I don't have anything prepared there, but while I've got you there, is the governor doing too much or too little, do you think, in your estimation, as far as what he announced yesterday? He's going to get criticism from both sides, of course, and of course, to a potential shutdown of businesses possibly next week it could be catastrophic. I mean, what's the line that he's got to straddle, and is he straddling it or taking a step either way too far?
Well, generally, when you're being criticized on both the right and the left, that means you probably are doing what needs to be done and showing leadership. And again, following science and the guidance of medical experts, and not overreacting, but also making sure that, the bottom line is this is in the hands of people of Columbus and Ohio. We know what we have to do. And we know what is required in order for us to flatten this curve and not overwhelm our health systems. And so he put that challenge out to Ohioans, in addition to other resources. And he also made clear that we will take action if this surge continues. He's made difficult choices before, some that were very unpopular. So have I. And that is our job as leaders. Listen to experts. Follow the advice of our medical community, and protect the health and safety of our community and our state. And I stand with him in that work. I think one more question from Lacey Crisp.
Thank you, Mayor. I wanted to follow up on Tom's question and ask you if you're concerned about the deeper financial impacts if there is another shutdown. My other question is, because I don't have the exact numbers in front of me, what was CPD's budget for last year? Is it increased this year, given the amount of violent crime that's going on in the city right now?
The first question again was about the economic. I'm trying to remember your first question.
If you're concerned if the governor does in fact shut down bars, restaurants, gyms next week, as he had threatened to last night, if you are concerned about the financial impact that's going to have on the city and this proposed budget. And then I want to know comparatively last year's CPD budget compared to this proposed CPD budget, given the violent crime the city has seen.
Yes. So the first question, absolutely, I'm concerned. Anytime you're dealing with an economic crisis and the threat of a longer term economic recession, as you know, Lacey, nearly 80% of our general fund, our basic city services, comes from income tax revenue. And so anytime people aren't working and working decent paying jobs, basic city services are at risk. By not touching the Basic City Services Fund and the Rainy Day Fund to balance this budget, we do have some resources. But a $41.5 million reduction made during the course of the year this year is something that certainly we have to contemplate something of that size and scale going into next year. And so we'll continue to work with City Council to make adjustments, make difficult decisions. Based on what the auditor tells us is available and that we have to invest in basic city services. Specific to your question about public safety, we've earmarked $635 million for public safety, $337 million for police. That's roughly $20 million less for police than last year, but it's important to understand that resources have been shifted to public health. So 15 million more than last year's proposed budget, and neighborhoods $2.5 million more than last year's budget. And public health and neighborhoods are going to be working with and embedded in the Division of Police to make sure, again, that we have the right response at the right time. So those officers are able to focus on the most pressing issue for us as a community, and that is reducing and fighting violent crime. We still anticipate 2 police recruit classes of 45 each, which we've done consistently ever since I have become mayor, and the budget for fire increased by $6 million this year. Does that answer your question, Lacey? I guess so. Any other questions from the press? Seeing none, if there are any additional questions that folks develop during the course of the day, please reach out to Robin Davis in my office, and she'll make Director Lombardi, myself, or other directors available for any questions. But really appreciate everybody joining us here today. Please continue to lift up everyone in our community to face this daunting challenge ahead of us. Pray for loved ones that have been stricken with COVID-19, and continue to pray and lift up our first responders and healthcare workers. We know they're overwhelmed, they're exhausted. They need us to lift them up in prayer and support, but they also need us to do the right thing. And we all know what that is. Wear a mask, socially distance, wash your hands, and avoid large groups. God bless. Have a great day.